Thank you, everybody, for coming here this morning for our 58th visiting professor, Stikeman visiting professor. It's great to see all of you and many of you in this celebration. We are fortunate today to have Jillian Stikeman, who's with us today from the Stikeman family. This visiting professorship is in honor of her father, Richard Allen Stikeman, who passed away way too early from mesothelioma in 1960s. And the family came together to fund this absolutely incredible visiting professorship. A visiting professorship where we've been able to attract really the greats of our specialty, the pioneers of our specialty. And we are fortunate enough to have one of those pioneers with us. And it's suiting today that we honor him with being our 58th visiting professor, Christo Ivanov Tchervenkov. Most of us don't use all those words. We just call him Dr. T or Christo for short. And Christo has had an amazing career supported by an amazing team at the Montreal Children's and at the McGill University Health Center. Coming from communist Bulgaria in search of freedom. When most of us were toddlers or maybe not even born, Christo was already at McGill University at the age of 16 when the visiting professorship started. And he's had a tremendous career, intensely focused on what he does, has become an internationally known congenital cardiac surgeon in an environment of a low volume center. And I remember reading a paper once about volume and outcome, and volume and outcome were linked, except for one hospital. There was a little asterisk on it and was marked the Montreal Children's Hospital. And that was Christo and his team in the 1990s and early 2000s that were able to perform such miracles on little kids. Christo came to work in 1987 after training with Aldo Castaneda in a paradigm shift in neonatal surgery, working on neonates with transposition, tetralogy of Fallot, and hypoplastic complex lesions that I still have difficulty trying to sort out and anatomically figure out. But Christo has an ease that's quite remarkable. He's an academic, an educator, founded the World Society for Pediatric and Congenital Heart Surgery. He's extremely passionate. Intense would be a word that would describe Christo, but not completely. He's an understatement. He's loyal, fiercely loyal to his institutions, to his colleagues, and the loyalty to his patients is incredible. And when we talk about putting patients first, well, Christo was doing that way before that became our lingo. So Christo, I'd like to welcome you again here today. I think it's a great honor for us. I'm very happy that you accepted. And I'll also give you a little anecdote very quickly. Christo was a chief examiner at the Royal College in Cardiac Surgery. He gave me a lift to the exam from Montreal to Toronto, and I was in his white Cadillac. We were talking about that this morning, big white Cadillac, the Pimp Mobile. It's white, got white vinyl, it's white leather on the inside. And as we were going up, we were playing music, but there was only one cassette there. It was Elvis Presley, Greatest Hits. I listened to Hound Dog, Jailhouse Rock, Love Me Tender way too many times. And during my exam, which was written, I had the words of Hound Dog in my head. So I told my wife I wasn't sure I was going to pass the exam, but anyway, I did pass. He wanted to drive me back. I said, it's okay. I get my own lift. How do I advance this slide? I think if you see it like that, that's one. I think. Just a brief, if you want to get CME credits, you just have to scan this. I'll give you 30 seconds to scan that code. And then I'll let Christo go.
Thank you, Kevin. That was a wonderful introduction. Most of it was true, maybe all of it. I'm really humbled to be standing here in front of you. The former colleagues, trainees, members of the huge multidisciplinary team, nurses, perfusionists, anesthetists, cardiologists, everybody. Friends, colleagues from all over the place. The first Stikeman I ever attended was in 1981. I was a second-year resident about to start my research year that Tony Dubal invited me, and that kind of planted the seed in me of the importance of the Stikeman professorship. Way before others did it, the Stikeman family with Doug Monroe and Tony Dubal and Dave Mulder had the foresight to establish this great professorship. And it's almost like a dream. I don't know if it's reality or not, to be standing in front of you 45 years after my first Stikeman professorship attendance. There's so much to say about the history of cardiac surgery and the study and treatment of congenital heart disease. I don't know where exactly to start, where to end. It's a very extensive topic, requires hours and hours of discussion. I'll do my best to give you a little bit the overview, like a bird's eye view of this journey. So one does not choose one's parents or time and place of birth. However, one does choose a purpose in life and the companions for the journey. Life is full of choices and decisions. It's full of countless interactions with others. Is this a series of coincidences or is it destiny? You might wonder, why am I showing this picture? The Napoleonic Wars were raging in Europe. This is about 20 years after the American independence, a few years after the French Revolution, and the 1791 Constitutional Act in Canada, dividing Upper and Lower Canada colonies at the time. The reason I'm showing this picture is that this is where the seed for McGill's interaction and contribution to congenital heart disease began. This is Andrew Fernando Holmes, who was born in Cadiz, Spain in 1797. Why does that matter? Well, his parents were trying to get to the New World on a British ship going to Montreal when it was hijacked by a French frigate in the middle of the Napoleonic Wars. They were taken prisoners and ended up in Cadiz, Spain. This is where Andrew Fernando Holmes was born. Eventually, the family got out of Spain and made it to Montreal, and he became one of the 4 founders of the Montreal Medical Institution in 1823, which, with the establishment of McGill University, became the first faculty of medicine of McGill University. He ended up being the first dean of medicine at McGill University in the 50s and 60s, 1850s, 60s. And in 1823, just about when he was starting his practice, he looked after a very sad patient, 21-year-old Isaac, who died of cyanosis and heart failure. He did the autopsy. Now, this specimen is incredible. I'll show you a picture of that, because all over the world it's known as the Holmes heart. Holmes, the first dean of medicine at McGill. And then, of course, there's the Holmes Gold Medal for the highest graduating medical student. So this is amazing. I mean, you're talking about 200 years ago, and there's this young physician taking a boat and going over to Edinburgh to present this case of a malformation of the heart. This is a unique specimen. It's over 200 years old. And there it is. This specimen is an example of a double inlet left ventricle. So this is a single left ventricle with tricuspid valve and mitral valve coming into this left ventricle. But what is rare, because when you have a double inlet left ventricle, you usually have transposed great arteries. This patient had normally related great arteries. There's the aorta rising from the left ventricle, and the way the cut is made, this is the right ventricular infundibular chamber leading to the pulmonary artery. This specimen sat for 75 years in formalin. It was well known to another luminary I'll talk about, and was last mounted in this format in this glass jar, which is at the McGill Maud Abbott Museum in the Strathcona building by Maud Abbott. This picture was taken in 1991 during the visit of Stella and Richard Van Praag to Montreal, and together with Tony Dubal, they wrote this very incredible description of the heart as well as the times. So the second luminary that's connected to congenital heart disease is William Osler. He's a McGill graduate from 1872. He became a McGill professor 74 to 84 before going to University of Pennsylvania, Johns Hopkins, Oxford, and of course the Osler Library. Upon his death, he left his books to his alma mater, McGill University. He mentored Maud Abbott, and also he established this Principles and Practice of Medicine textbook that it's a classic known all over the world. By the time Maud Abbott came on the scene, Osler was already at Johns Hopkins. Now, what's special about Maud Abbott, in addition to everything else she's accomplished, is that she wanted to study medicine, but McGill did not accept it because women were not admitted at McGill University in medicine. So she went to medical school in Eastern Townships, Bishop's University for about 35 years at a medical school. Then she was appointed an assistant curator of the Anatomy Museum upon coming to Montreal. And during a visit to Johns Hopkins to visit William Osler, they talked about this specimen that she encountered, the Holmes heart that had sat in a jar of formalin for 75 years. Now, this specimen was very well known to William Osler because at that time, the medical professors, they used to do all the autopsies. He did maybe 700 to 750 autopsies at the Montreal General Hospital. So they discussed the case, and she went, stimulated by that encounter, she went on to study close to 1,000 hearts, proposed the first classification for congenital heart disease, and published this historic atlas of congenital cardiac disease by the American Heart Association in 1936. Now, the first half of the 20th century, there was no open heart surgery. 1938 was the first PD allegation by Robert Gross in Boston. First coarctation repair in 1944 by Crawford in Stockholm. And of course, the Blalock-Taussig Thomas shunt was performed on November 29th, 1944, giving a hope to blue babies, most of them tetralogy fellow. What happened in the first half of the 20th century? Horrible, horrible. Wars, never-ending wars, 1 and 2. Two of my great uncles were killed in World War I. My grandfather survived. And this was the story in the world in the first half. So, crossing paths of history, right? World history, medical history, personal history. 1953 is a very important year for many reasons. Stalin died on March 5th, 1953. Horrible man. And that opened the door for a thawing in the Eastern Bloc countries, allowing us eventually to defect to the West. The first open heart operation done by John Gibbon Jr. in 1953, May 6th. Tony Dubal was a fellow at Jefferson Medical College. I think he looked after the patient on the second night post-op. You might say, oh, great. Well, he only did one operation. This successful operation was done. He lost another 5 patients and he abandoned. But he proved the proof of concept that it's possible for life to be preserved with a heart-lung machine. At the same time, many others were trying to build a heart-lung machine, and there were many other deaths unreported by pioneers. So this was a serendipitous outcome. And then finally, I was born on July 19th, 1953 in eastern Bulgaria, a town called Yambol. My parents were medical students at the University of Sofia, and I was born 2 weeks after my mother wrote her final exams, 8.5 months pregnant in Sofia. And since my father's family came from that town, Yambol, I was born during the summer holidays. Now, this is also behind the Iron Curtain. Bulgaria was a country that was part of the Warsaw Pact. and it was like a prison. They kept you inside. They didn't let you leave. It was a miracle if you could defect that prison, which was communism. You can see me with playing soccer here, and I grabbed the ball and I wouldn't let go. I wanted to be the one with the ball. I don't know what that meant. My parents were sent to Algeria to help. Algeria was independent for 4 years and had aligned itself with Soviet Union. So a lot of the Soviet Union and Eastern European countries would send specialists to help the Algerian state. And at the same time, I learned French and I went to Lycée Victor Hugo in Alger. And then, miracle, we were able to defect to the West, arriving in Montreal in Dorval, August 7, 1968. Cardiac surgery is only 15 years old at that point. Think about it. And we're very, very lucky. Most people went back to Bulgaria. My parents had the guts to defect through West Germany. We arrived in Montreal as tourists. We declared political refugee status. And lo and behold, while others were put back on a return plane from Italy, whatever, to go back to where they came from, not exactly illegally, but as tourists, we were kept here because 2 weeks after we arrived, the tanks rolled in Prague. The Prague Spring came to an end, and this is the Soviet Union tanks, and Warsaw Pact invaded Czechoslovakia. I started McGill in 1969. McGill has been my home for close to 60 years or 57 years. Wonderful university. I learned English. I went to French high school in Montreal, got my certificate in French, and then I went to English university to learn the language, because you can't study medicine in North America if you don't speak English. I mean, you can get by in French, but English was very important. And I was reminiscing, came across a class picture here, class of 78. I was the class president. And something occurred to me incredible. I don't know what it means, but you remember 1969 was the first year the Expos played in Montreal. There was an incredible excitement in Montreal about baseball. And of course, I bought a baseball glove and a bat and a ball, and we played baseball. So look at this. These three leaders of surgery in this faculty of the class picture. There's Lloyd McLean, chairman of the Department of Surgery, surgeon-in-chief of the Royal Victoria Hospital. Tony Dobell, surgeon-in-chief at the Montreal Children's Hospital, and young Dave Mulder, surgeon-in-chief at the Montreal General. Looking at this, a symmetry came in my mind. This is like a baseball diamond. I'm coming at bat, and the bases are loaded. First base, Tony Dobell. Second base, L.D. McLean. Third base, Dave Mulder. I hope I can hit a home run. That will be a grand slam. I didn't hit a home run. It took a lot longer than that. So my life revolved around training as a rotating intern at the Royal Victoria Hospital, 5 years of general surgery at the RVH, and then cardiovascular thoracic by doing rotations at the Children's and the Montreal General Hospital. These are my 3 hospitals. I'm so proud of them. So what happened with cardiac surgery in the meantime, in the 50s, 60s, 70s? First repair of tetralogy fellow, 1954, by Lillehei. How did he do that? With cross circulation, the parent serving as a donor for oxygenation. Amazing, eh? There were about 30 cases done by Lillehei, and of course, as soon as the cardiopulmonary bypass became very, very feasible and predictable, that was abundant. Imagine an operation with 200% mortality. Sanning in 1957 for transposition, Mustard in 1964. These were atrial switch operations. The Ross procedure in 67. Donald Ross actually did 8 arterial switches. They all died. He says, it's not for me. So he focused on the valve and the Ross procedure. The Rostelli operation was proposed in 69. The Fontaine operation was successfully done by Francis Fontaine in 68 in Bordeaux, France, only reported in 71. The arterial switch, 1975. I was in second year medical school when the first arterial switch was performed with success by Adib Jatini in Sao Paulo, Brazil. Norwood operation by Bill Norwood from 79 to 81. And what was really meaningful, that one of these Norwood cases eventually had a successful Fontaine operation, which is an operation for single ventricle. after Norwood, and this was published in the New England Journal of Medicine. So Dr. Dubell had the foresight that the next paradigm shift is to operate in babies. So I was off to Boston Children's Hospital to train with Aldo Castaneda, who's considered by many to be the father of newborn heart surgery. Amazing man. Why did this paradigm shift happen towards early repairs, especially in neonatal surgery? Well, look at this. I'll highlight one malformation. You can't cover them all, but this is transposition with intact ventricular septum, the aorta rising from the right ventricle, the pulmonary artery from the left ventricle. The two circuits are not in series, they're in parallel, they're kind of independent of each other. Most of these babies die without a procedure, Blalock-Hanlon atrial septectomy, and later the balloon atrial septostomy. And the operations that were done later on in the first to second year of life was what's called the atrial switch. Through very ingenious incisions and moving of the interatrial septum, Senning did the first Senning operation. Mustard used the buffle, pericardial buffle. There was a problem with these operations. I mean, they were fantastic. The problem was that by the time they were done, 10% of the patients died while waiting for the Senning or the mustard. The second thing, it's a physiological repair. It leaves forever the aorta coming out of the right ventricle. And with time, the right ventricle can fail. There were also a lot of arrhythmias. So people were looking for a direct solution, even since the 50s, which is the arterial switch operation. Now, I give you an example here from a chapter we wrote in Gardner and Spray textbook. Imagine the cases we do nowadays. This is a transposition of the great arteries. There's a ventricular septal defect. There's subaortic stenosis. There's hypoplastic aortic arch. When we do the repair, we close the VSD, open up the subaortic area. We move the coronaries to the new site. We repair the aortic arch, and we achieve a complete biventricular repair. It's about 6 or 7 malformations repaired at the same time, but had to be done in babies, especially the ones with the intact ventricular septum. So after my return to Montreal from Boston with Dr. Dubell's guidance, there were no previous series. We had started, at least in our institution, neonatal infant surgery, and it took a few years before we could build up series so we can publish and present. And because we tackled a lot of complex lesions, even some lesions that I hadn't even seen repairs in Boston, then we had a series of publications over the first 10 years of my practice, basically established ourselves with a credible center with very good results. The first Norwood operation for univentricular heart, other than hypoplastic left heart syndrome, was for tricuspid protrusion with transposition of the great arteries. We did that, and there's David Latter's name here. This is in 1988. A series of double outlet right ventricles primary repairs, probably the first report of a consistent early repair for DORV. There's Danny Morelli right here. And then a series of other publications on very complex repairs. Mark Pelletier is here. I'm highlighting the residents at the Children's, Steve Tata, Gary Salasidis, Renzo Ciceri, Steve Corcola, Dominic Schumteam, etc. This is the publication I'm most proud of. Was in circulation in 1992, which highlighted the institutional risk factor for mortality. And I was one of only 4 authors, John Kirkland, Eugene Blackstone, and Aldo Castaneda. Imagine having a publication like that 5 years into your practice. It's incredible. We presented our results in the first decade to the Canadian Cardiovascular Society in Ottawa in 1998. We had operated on 606 open hearts. There was a time when the Children's was performing only 50, 60 open hearts before this series started. And we received a lot of referrals across Canada, about 200 in those 5 years. 208 patients, not previously operated, were referred for surgery, and we had 98.6% primary repair rate with a less than 2% mortality. And the biggest group among these patients was the arterial switch operation, 55 patients, some very complex forms with only 1.8% operative mortality. 25 years into my practice, this was just before we moved into the Glen. We were part of the Society of Thoracic Surgeons congenital database, and you can see in green, this is the Montreal Children's Hospital. We have clearly lower mortality than the average. And this is for complex cases. Again, we're performing extremely well. And that has continued with the new generation of surgeons, Pierre-Luc and his colleagues. I don't know why there's a black bar here, but anyways, this is a patient I repaired very, very complex LARA in 1989. That shows her in 1997, 10 years of age. Here, I don't know why this bar is covering the picture, but this is in 2015, and now 36 years later in 2025. Lara worked for many years at the MOD unit, the Adult Congenital Clinic. Amazing girl. I'd like to give a lot of credit. This is the second paradigm shift, which is towards organization of adult care for patients with congenital heart disease. And I give a lot of credit to Ariane's energy to establish the MOD unit, initiate the Montreal General Hospital, and then to the Royal Vic. And Judith Perrien, the current director of the MOD unit. And I'd like to highlight Ariane's academic contribution as editor of the Perloff's Clinical Recognition of Congenital Heart Disease. Ariane, this is a picture with Jane Somerville. I've had many, in my few encounters with her, I've had many heated discussions. Jane Somerville is considered the mother of adult congenital cardiac care. I think we're well positioned at the Glen on one side to have from fetal, neonatal surgery, infant surgery, and all the way to the adult spectrum from beginning to end. Congratulations, Ariane, and thank you very much, you and Judith Perrien. The next paradigm shift came, we started focusing on quality assurance and improvement. And before you can do any comparison, any analysis, you have to have a common language. You have to have a proper nomenclature. Well, lo and behold, I was invited to be part of the STS, Society of Thoracic Surgeons nomenclature project. We published this huge brick of all the classification of all the cardiac phenotypes, which is thousands of cases. At the same time, not known to us, the European cardiologists published the European Pediatric Congenital Cardiac Code. Now we had all of a sudden two very important competing nomenclature systems that were not talking to each other. They were not identical. The European was more atomic. The surgeons was more molecular. Give you an example. In the European system, transposition VSD would be 2 codes, and in the nomenclature of the North American surgeons would be just 1 code. So we met at the World Congress in Toronto in 2001 at the International Summit on Nomenclature. We organized and said, what do we do now? We're not going to restart the process again. Just imagine a database in a center. Which system would they use, the cardiology or the surgical system? So we established a nomenclature working group, and I have to highlight also Marie's pioneering contribution in this process that has been going on for 25 years. And we decided to cross-map the two systems, adopting the 6-digit code of the European Pediatric Code. Marie negotiated the transfer copyright from the AEPC to the International Nomenclature Society. These are the two luminaries of congenital morphologies, Richard Van Praag from Boston, Bob Anderson from UK, the Van Praagian School of Nomenclature, the Andersonian School. They endorsed the process of cross-mapping. In this group picture, you can see Giovanni Stellina, a surgeon from Italy, looking at the Holmes heart. We brought the Holmes heart to stimulate people into this project. After 4 years of arduous work of 6-day biannual meetings, two a year, sitting in front of computers from morning to night, we were able to present the International Pediatric Congenital Cardiac Code at the World Congress in Buenos Aires, Argentina. And this was updated. Definitions were provided for most terms. Controversial lesions were debated, and papers were written. The World Health Organization mandated the Nomenclature Society to provide all the congenital codes for the ICD-11. And we had this landmark publication in Cardiology in Young, and at the same time in the World Journal, that's authored by all these members of the Nomenclature Society. Quite an achievement. François Lecourguet, a surgeon from France, used to call us, we are crazy, travail de fourmi. And he stormed out, says, I'm not going to do this. Anyways, in 2019, the Nomenclature Society met in Montreal, and we went up to the Maud Abbott Museum. This is a picture outside. Something I learned very recently. There's Marie Belin, there's Bob Anderson, Jeff Jacobs, and Rick Fraser, the pathologist, making sure we don't damage his specimens. Now, look at this plaque, terracotta plaque. There were 99 such plaques, 33 per floor at the Strathcona Medical Building. Not a single one was a woman. These are all professors at McGill, etc. Mostly from previous century, but anyways. So it was decided to have a plaque for Maud Abbott, the 100th terracotta plaque, the first woman that's recognized in the Strathcona building. Just keep that in mind. So the next paradigm shift is international collaboration. I became the chairman of the program committee of the Congenital Heart Surgeon Society that was founded by Tony Dubell and his colleagues 25 years earlier. And we organized for the centennial of the Montreal Children's Hospital a joint meeting between the North American and the European colleagues. As I looked around this picture around the room, I said, where's the rest of the world? We just have North American talking to Europeans, and what about this huge world that is developing around us? So I had been nominated to be the president-elect of the Castaneda Society, which is the Boston Club. We organized a session at the World Congress in Buenos Aires entitled Towards the World Society. We received a mandate in unanimous support to establish a World Society for Pediatric Congenital Heart Surgery. I chaired the Constitutional Council of 31 members from all continents. We wrote the Constitution. And we had the first meeting in Washington in 2007, where during my presidential address, I talked about medicine of respect with the components of responsibility, education, most important, sustainability, partnership, empowerment, care, commitment, teamwork, and trust. 2 weeks before this meeting, I received a letter of encouragement from Nelson Mandela through contacts on a patient side and on a colleague side. They got to Nelson Mandela, and he sent this letter endorsing to work towards the goal that every child anywhere in the world with a congenital heart defect should have access to appropriate medical and surgical care. And I encourage all those that can help in your mission to join hands with you in a challenging journey. On behalf of South Africa, continent of Africa, from all the children of the world, I wish you good luck and Godspeed. A year later, I had the opportunity to meet the great man himself. And if you look at his face and my face, you can sense the genuine smiles of the moment. On to honoring Aldo Castaneda on his 80th birthday, we organized a multi-societal and mainly driven by the World Society meeting in Antigua, Guatemala. Just imagine hundreds of surgeons from around the world in this little Central American country. Why Guatemala? Because Aldo Castaneda was Guatemalan, born in Genova, Italy. And after he retired from Boston Children's, he went to establish a center in Guatemala City. And here you can see in the picture, Aldo Castaneda, Bill Norwood, and Richard Jonas. What a wonderful meeting. Now, what is incredible, we talked about coincidences. Nelson Mandela is born on July 17th. Aldo Castaneda is born on July 17th. Nelson Mandela on July 18th, and I'm born on July 19th. I don't know what it means. Is it that Aldo's passing the baton at midnight to Nelson, who's passing the baton to me at midnight? I don't know. It's just too much. The World Society organized meetings around the world. To highlight a few, this is in Turkey, the third scientific meeting. This is Francis Fontana and Guillermo Kreutzer. In South America, it's known as the Fontana-Kreutzer operation. This is in Sao Paulo in 2014. Marcelo Giattini was the host of the meeting. This is his father, Adib Jatini, who performs the first arterial switch. Can you imagine? He gave his last talk before he passed away a month later at this meeting. I started listening to the translation in Portuguese to English. I had started intense course of Portuguese over 6 weeks before the meeting, and after 5 minutes, I removed the hearing aid, and I just listened to his presentation in Portuguese, understanding about 80%. Not bad, not good. I'd like to highlight also the 10th anniversary meeting in Abu Dhabi, hosted by Zohair Al-Khalis, my friend from probably the most prominent surgeon in the Middle East. He has a few family members that are training at McGill. His son, Abdul Rahman, is a radiology fellow currently at McGill. And you can see in this picture, Jim Kirkland, Richard Jonas, this is Joe Derani, past STS president, and Magdi Yaqub having a conversation. This meeting of the World Site in Florida in 2018 was very memorable for one main reason. Just to show you by serendipity, these are the first 8 presidents of the World Society, and the current president is Kirsten Finucane from Auckland, New Zealand. I went for supper with my African friends while everybody else was elsewhere, and I basically asked them, do you think there's a need to organize the African congenital heart surgeons? Africa is a very difficult continent for communication for multiple geographic reasons. They felt it's a great idea. So Darshan Reddy is from Durban, South Africa, Frank Edwin from Accra, Ghana, and Professor Etiuma from Calabar, Nigeria. They all were thrilled that we would do it. We wrote the Constitution just we did for the World Society, and we established the African Society for Pediatric Congenital Heart Surgery. And the first joint meeting was in Marrakesh, Morocco. There's Drissi Boumzebra, who's the local host, who's the current president. Frank Edwin, the first president of the African Society. There's Zohair Al-Khalis. And I just bring you attention to this logo. Together we go far. It's an African proverb that says, if you want to go fast, go alone. If you want to go far, go together. We welcome the African Society who wanted to adopt the World Journal for Pediatric Congenital Heart Surgery as their publication. And now I'm coming to another topic of discussion, which is training and education. This is the wall at the office at the All Children's Hospital. Dr. Lobel has started the tradition that every resident spending 6 months at the Children's will have his picture with his favorite patient. And you can see many notables here. Benoit, I'm sorry you didn't, somehow we didn't, like, you were cut off, but you were there. There's Kevin LaChapelle. There's Kevin LaChapelle. There's Richard Novick. There's David Lauder, Garrett Walsh, Tom Burden. 2 kids, huh, Tom, you remember? The one that had a tear with a balloon septostomy when massaging, take to the OR. Wait, Tom, oh, there he is. It's amazing, huh? Anyways, who else is here? Well, many people. There's Dominic Shuntim. There's Danny Morelli, Dan Nguyen, Steve Corcola. Anyways. So we established a Global Council on Education for Congenital Heart Surgery in 2019. We had multiple meetings trying to assess what's the status of this specialty around the world. Now, the Royal College has these attributes of a specialist expert. And I put together a much more extensive, what is a surgical expert? All these attributes. We asked to fulfill many roles, very challenging. But the most important thing, you have to be a skillful surgeon to be a surgical expert. We published the current status of training around the world in the World Journal after these debates. And it's a hodgepodge of systems. One example, Argentina, you go after you graduate from medical school, you go straight into congenital heart surgery. And of course, you have multiple years of training. The Royal College has no recognition of congenital heart surgery as a specialty. In the United States, there's a definite board. There's a recognition of the specialty. And it takes, used to be 1 year of training. Now it's 2 years of training after you finish cardiac surgery. Very important topic. The last thing I want to tell you about is the pandemic came in 2020. We were supposed to meet in New Delhi, India. It didn't happen. We organized a Zoom call with about 45 prominent surgeons from around the world, and Pierre-Luc-Emile Basho was on that call. We decided to start an online education system of webinars, partner with all these organizations through the support of a fund, endowment fund that my family built up at the Montreal Children's Hospital. And the Children's Hospital Foundation has been incredibly supportive. In 6 years, we've run 55 monthly webinars with around 500 speakers and co-chairs and 40,000 registrations from all over the world. The rule is, between the presenters and the co-chairs, they have to come from at least 4 out of 6 continents. The 3 co-chairs have to be from 3 different continents. And I don't know how much time I have. Okay, let me just, okay, so let me click here. I'm coming to the end, another 10 minutes. We established the World University for Pediatric Congenital Heart Surgery. And what I want to show you is that the faculty. So just look at this faculty. There's about, I don't know, hundreds of pictures here. Indonesia, Netherlands, India, Ethiopia, Brazil, Germany, Saudi Arabia, Malaysia. These are all the faculty speakers from all over the world. Nigeria. Destis Karkavaye, Joe Derani. And so that's one thing. We put you on the faculty page. There's Jim Kirkland. And I don't think we'll get to me. Tchervenkov, right? It's towards the end of the alphabet. There am I. Okay, then the other thing I want to show you very briefly is this is how each webinar starts. This is a 2.5-hour webinar.
Worldwide, each year, 1.4 million children are born with congenital heart defects, and over 350,000 children acquire heart disease. You are taking care of them. The vision of the World University for Pediatric and Congenital Heart Surgery is that every healthcare professional, anywhere in the world, involved in the care of patients with pediatric and congenital heart disease should have access to ongoing education. Education, communication, mentoring, knowledge everywhere and for all. Imagine being part of it.
So these are 2 powerful tools for education, global education, the World University and the World Journal, which we established 15 years ago, is the only journal exclusively dedicated to pediatric congenital heart surgery. I want to tell you a little story very briefly. This is the logo of the World Society, and you have a surgeon here and a little boy. This is how the logo was first. I showed that to my wife, Sophia, and I said, what do you think? It's a great logo. And she says, where are the women? I said, at the time, this is 20 years ago, I said, well, almost all congenital heart surgeons are men. Yeah, but half of your patients are women. So we added the little girl. Thank you, Sophie. I don't know if Jean Morin is here, but anyways, when I was wrapping up my rotation at the Royal Vic, he came to me, he says, we'd like to buy you a book. The Kirkland textbook, which is really the cardiac surgery Bible, had just come out, the first edition in 1986. And this is what Jean wrote to me. Dear Christo, it was a pleasure for me to work with you during your last rotation at the Vic. We had good cases and excellent results. I'm sure that you will have a very successful career with significant accomplishments. Best of luck to you, Jean-Edouard Morin, January 22nd, 1986. Lo and behold, did I ever know that 40 years later, I'll be one of the editors of the 5th edition of the Cardiac Surgery Bible, the Kirkland Barrett Boyce Cardiac Surgery, along with Jim Kirkland from University of Alabama, Hartzell Schaff from Mayo Clinic, Blackstone from Cleveland, Francis Pagani, University of Michigan, and proudly carrying the McGill flag, yours truly. Look at the artwork of this textbook, this front page. This is the work of Richard Tang, one of our trainees. Rick, where are you? There he is, amazing artist. Amazing, Ricky. Rick has joined the staff at the University of Pittsburgh as a congenital heart surgeon. So we talk about Dr. T's T's. If you want to be successful, forget about what they talk to you about quality of life and all that. Quality comes with a good career. You need toughness and tenacity. That's part of resilience. You need teamwork and trust. Otherwise, people won't follow you. And boy, do you ever have to grab the timing, right moment. Teamwork. This is a picture probably in 1991, and everyone is represented here. Perfusion, nursing, residents, there's Steve Tatas right there. Cardiologists, anesthetists, intensivists, respiratory tech, huge team. The team is much bigger now, much better. It's just an amazing. We went from a time when Tony Dobell would do an operation, and I would get called for every potassium, every little PVC, every little thing, up and down to the, not an ICU, was the recovery room, one corner of the recovery room at the old children's, to now having this huge multidisciplinary team. What a success story. So the crossing paths of world, medical, and personal history have shaped the essence of my life. Is it the result of coincidences or is it destiny? My dad passed away in 1999. My mom is still alive in 1993. This is a picture of them with our kids who are very much grown up now in their 40s. Our grandkids, Liana and Mason. Lian, almost the same, Liana. And of course, I'd like to give credit to my brother. He's played a significant part of my life, bouncing ideas, supporting each other as a transplant surgeon. And actually didn't realize until recently he's been doing all the pediatric kidney transplants at the children's for, I don't know how long, maybe 25 years. He sends his regards. He's at a meeting in Geneva right now, but I think it's a decoy. He's with his first grandson in Lausanne. That's what I think. Why am I showing you this picture? This is the capital of the country I was born in, Sofia. There's the Faculty of Medicine. This is the Vitosha Mountains. That's where I skied for the first time and before we defected. What a coincidence. Can you imagine somebody from Sofia, Bulgaria, falling in love with another Sofia? This is Sophie with our daughter, third-year medical student. This is at her graduation from medical school and then as an obstetrician gynecologist. And I just tell you one thing, maybe it's stupid what she did, maybe not, but it showed toughness. She was on call 48 hours as a chief resident at the Royal Victoria Hospital with a ruptured appendix. And on Monday morning, when her call was finished, the 48 hours, I had asked Antoine Lutfi to go and find out because she was in a lot of pain. Go and check her out. I hope it's not an appendix. She said it's an appendix. She had done her pre-ops, was being wheeled in a wheelchair after call finished to the main OR at the Vic, while Antoine was coming up to look for her. You remember that, Sophie? Anyways, she's my rock. And with great humility, I stand in front of you. I thank every member of the team that has supported, not only me, but the kids. It's all for the kids and the families. And from the bottom of my heart, thank you so much.
Thank you, Christo, for a whirlwind tour. I'm sure there's some maybe questions that if you have some questions, you can, or comments, you can use the microphone. There's a little button there. You're tough. And I remember we had a Royal College meeting. Remember they were there and they were talking about balance of life and quality of life. And I remember you got up and you forcefully put your hand and said, we're not training, we're training Marines. Marines. And I knew there when you said that, we were done. We were finished. How would you, looking to the future, you've done an amazing work. You've been at kind of the right time and frame, but obviously you created, you're a great innovator. You created opportunities there. What do you think the next opportunities are in congenital surgery?
It depends from what perspective you look at. Depends what perspective. I've often said in discussions, we don't need any new inventions to improve care for the majority of kids around the world with congenital heart disease. All we have to do is provide the resources and apply what we know today. Now, from a different perspective in the high-income world, there's so much going on: 3D printing, virtual reality, simulation centers. But there's no substitute for hands-on learning, this craftsmanship, this, I'm looking for the word, artisanal, yeah. I think it's going to be very difficult, very rewarding for the next generation and the current generation because the results are spectacular. But don't forget, many lesions have to be looked after a lifetime. There's lots of problems long-term. But I think the bar has been set so high by many of us that I feel sorry a little bit. It's difficult for the next generation. How do you stand out? I'm sorry to say that, but if you have a 2-3% mortality with an arterial switch, even up to 5%, you might say, so what? It's great success. It's great for the kids you're looking after. But in terms of comparison, how do you stand out? Sometimes you stand out because of a bad result. But we have to be very tolerant and understanding. I know there's a lot of patient safety and all kinds of protocols and all that, but it still goes back to the old-fashioned approach. And anyways, it's a complex issue. There's a lot of stuff on the prior. I didn't talk about transplantation. We did the first baby transplant in Canada. Garrett Walsh looked after Martin for God knows how long. The first Berlin heart with Renzo and the people at the Children's. We've done a lot of firsts, but first, you have to maintain. And the new generation is performing very, very high. When I look at Pierre-Luc, I mean, amazing work. I don't know how much you have this patience, accuracy, it's to be admired.
There's a few questions. Dr.
Yeah,
Bolton?
Christo, I want to take you back a few years. First of all, congratulations on an incredible lecture. I'm not sure what year this was, but it was the year you finished your residency in cardiac surgery. You're on your way to Boston with Castaneda. And we were doing your evaluation. There was Ray Chu, Tony Dobell, myself, and Dag Munro. And at that time, the Royal College had adopted a new process of evaluation called a FITER, F-I-T-E-R, for a final evaluation. We went through there were 12 criteria. We looked at dress code, timeliness, all sorts of ridiculous things. And then we had to give the Royal College a numerical value that would be used at your final exam to complete the assessment. So anyway, after all this discussion, Tony DeBell said, I think we should give him 78. And Dag Munro said, oh no, he said, and Ray Chu kept talking about the Royal College and the fighter, and Dag Munro said, Christo's a fighter. And then he said, I want to give him, he has to at least have an A. So anyway, after all is said and done, we compromised and gave you an 80. And I just want to say how grossly incompetent we were.
Christo, il faut pas non plus négliger l'incroyable influence que tu as eue sur les cardiologues. Parce que de travailler dans un centre d'excellence aussi monte la barre très, très haut en ce qui a trait à nos attentes envers les chirurgiens cardiaques et nos collègues. Et je tiens à te remercier pour l'influence que tu as eue sur moi, sur une grande partie du cardiologue que je suis devenu est due à ton influence et je tiens à te remercier. C'était extraordinaire de vivre ces années très, très, très stimulantes. À partir du moment où, étudiant en médecine, je suis arrivé à ton arrivée et à l'arrivée de Marie par ailleurs. Et ma formation Children, puis ensuite ma croissance en tant que professionnel de la santé à l'hôpital de Montréal pour enfants. Les cardiologues t'en doivent beaucoup et je tiens à te remercier personnellement.
Merci Luc. Ça me fait chaud au cœur. Vous êtes à jamais, vous faites partie de ma vie.
La seule crainte qu'on avait, c'est d'être pris emprisonné dans ton bureau pour parler de politique.
Ariane has
Or soccer.
Ariane. Yeah,
Such a spectacular lecture. Thank you so much. I just want to highlight that so much of what you've done has been about establishing connections. Sometimes we don't even understand the connections you establish, but you establish the connections, you connect the dots in such a creative way, and you're never afraid of dreaming something big. And that's such an incredible source of inspiration. When I had to come back to Montreal and I looked at various different options, I said, where is the best surgeon? And the best surgeon was you, and you were at the Montreal General. And I came back and there was a little office. They had been very generous and converted a little bathroom into an office for me. And I just understood that the future had to be a partnership between the interventional and the medical. And, you know, you ask about the future, Kevin. The future is about that. It's about that watershed area, which is becoming less and less distinct as we move into each other's environments, whether it's the pediatric, the adult, the lifespan, whether it's the interventional, the non-interventional. That's where the innovation is. We will never be able to match the innovation that we saw in the latter half of the last century, but we're trying to invent a new kind of innovation. Thank you so much for that inspiration.
Thank you, Ariane.
Okay, Christo, thank you very much. We have the whole day ahead of us
Thank you
where you
very-
can sit and listen and comment as you wish.
And stay quiet.
And, well, no, we have some refreshments. I think we're coming back in, 15 minutes. There's no food or drink here. And those that have to upload their talks, if you could just do that during the break. Thank you very much.